working on a roof one afternoon, and just in the course of working, simply walking across the roof, and my leg snapped.
No symptoms, no warning, just a devastating diagnosis that can take your limb and take your life.
Once they biopsied that's when they discovered that it was a cancer, and a very rare cancer. I don't really know what the future is going to hold totally. It really makes you do some soul searching, and it's pretty powerful.
Bone cancer's victims can be any age, but many of them are teenagers. And if left without treatment, the effects of this disease can be deadly.
It just felt like a cramp, like cramping, like something was squeezing my leg at night, and it like a pounding, like that.
I was lost for words. I mean, I was crushed in my heart because it was just, something that I would have never in my vaguest imagination have accredited to Jamil at that time, because he was doing fine.
That's a very sobering thing. You have what you think is a healthy child or teenager complaining of a little uncomfortable sensation, because it's very emotionally charged to hear someone say your child has cancer.
Imagine a doctor who could gather the knowledge of hundreds of experts and focus on a single task. A doctor with no boundaries. A doctor with access to not only the latest technology, but with the ability to create technology that does not yet exist. These are the minds of medicine. This is their story.
Hello and welcome to Minds of Medicine. I'm Paul W. Smith. More than 2,000 people each year are diagnosed with a primary bone tumor, meaning a cancer that begins in the bone. Among these cancers are osteosarcoma and Ewing sarcoma. But what troubles parents, patients, and doctors is that these tumors have very few symptoms. Once they are discovered, patients can be left with a heart-wrenching decision: lose your limb or lose your life.
The discovery of it was kind of dramatic. Didn't think there was anything wrong. Just in the course of working, simply walking across the roof, and my leg snapped. The initial x-ray showed black tissue within the bone, and nobody at that time knew what it was. Once they biopsied that's when they discovered that it was a cancer, and a very rare cancer. I don't know if there's a more powerful word in the English dictionary that hits somebody the way that does, and everything that automatically goes through your mind when somebody says that you do have a cancer.
To help give patients a better option for bone cancer, the Josephine Ford Cancer Center and the Department of Orthopedics offer patients two of the foremost experts in the field: ortho-oncologist Dr. Michael Mott and orthopedic chair Dr. Ted Parsons. Their combined expertise in the surgical treatment of bone cancer is much more than any other group in Michigan. Today, they meet in a weekly tumor board to discuss all new bone cancer patients, including one from near Jackson, Michigan, Don Billinghurst.
The next patient is Donald Billinghurst. He's a 45-year-old gentleman who had the pathologic fracture of his tibia. We had seen and reviewed his pathology here, his slides. He was actually biopsied at an outside facility. His slides were sent here and reviewed. He carries a diagnosis of adenomyoma. Adenomyoma is a very rare primary malignancy bone, estimated to be perhaps no greater than 1% of all the primary bone malignancies that we see. So if you take that 2,000 to 2,500 number, 1% of those, I doubt that it's even that high. Mr. Billinghurst?
Hi.
Good. Prior to, let's say, the advent of modern chemotherapy and adjuvant agents, pretty much everybody was treat it with an amputation and a handshake and a pat on the back and kind of good luck. Now, with the advent of modern chemotherapy, what we do is we give upfront chemotherapy most often. We try to have a positive effect on the tumor, meaning the shrinkage of it, or at least no further growth. And then we offer limb salvage to the vast majority of patients. There are a couple of different things we can do for that. What I suggest that we do is we consider using a cadaveric bone. That's bone from somebody who died and donated it, and then we take it and we cut here, and then we match it up and size it in. And usually you can use either a rod or some plate and screws to hold it in place.
You always have the fear of any type of surgery. Everything can go perfectly right, except for one thing, and it could be a blood clot. It could be an infection. Everybody could do everything 5-star and something not work right.
All bone cancers are rare, but Don's tumor, known as an adenomatoma, has been reported in only a few hundred patients in the last century. Because of this, little is known about its origin or where the cancer might spread next. So Don arrives at Henry Ford Hospital for a difficult but necessary surgery, taking out the tumor as well as the bone around it and replacing it with a donated cadaver bone known as an allograft.
Reconstruction will be a bit tricky because we need to essentially plate the whole tibia. At the same time, we're compressing an intercalary segment, so it'll take us a few hours. And then before we close it, we'll put a muscle flap over it, so just help with the healing and decrease the rate of infection.
As Dr. Mott cuts through skin, muscle, and bone, he must make sure he takes out enough excess bone around the tumor, called a margin, to remove all of the cancer and reduce the likelihood of it coming back.
How much margin are you taking just over?
I got a little better than 4, and up top I got 6, because I'm including that other one.
That should be plenty.
Exactly. I can feed up a little bit.
The new bone will be grafted into place, held together with rods and screws. The surgeon must make sure everything fits perfectly to create a strong connection to Don's remaining leg bone. Without a strong graft, Don will be at a higher risk of infection, and the surgery may have to be redone.
Okay, so basically now we have the allograft fixed in. This is the cadaver bone. You can see it matches pretty well with what he had. This is what the bone would look like without any periosteum on it. We've got a distal osteotomy site, we've got a proximal osteotomy site. Can't see too well. We've preserved the soft tissues there and there, only really taking it off where we need it to. And what we want to do is put this through a gentle range of motion, make sure that it's stable.
A skin graft will be placed over the muscle and bone to protect the allograft from infection.
So we'll take that graft over the muscle. This is what kind of the leg looks like. So we'll have that. This will shrink down as the muscles contract and be kind of small, and we can actually do it. This will shrink down, and we can actually revise a little bit with time. He's got some bulk here, but what we really want to do is have that allograft well covered, which it is.
After sewing this skin graft into place, Dr. Mott goes to talk to the family.
Hi there.
All done. Okay, everything went fine. You know, for the most part, I think we did everything we set out to do today. Took a little bit longer than what maybe I had thought it might, because I thought that things were just going to kind of fall off of there. But, you know, I just thought you have to just, you know, take your time if it's not going to mobilize for you. So it should be good.
Been a roller coaster, of course, and a lot of anxiety. But the weight's being lifted. It's being done. He's going to be able to heal and heal correctly, and he'll be able to do what he wants to do again.
Although the tumor has been removed, Don's road to recovery will be long and challenging. We'll check in with his recovery a bit later. Next, we'll meet a teenager who will need a team of doctors to remove his tumor and save his life. At any time, you can go to henryford.com to learn more about Henry Ford's Orthopedic Center of Excellence, or to make an appointment with a Henry Ford Medical Group expert. To get a free copy of this program,